I can't believe it. It's September already. Jeez. I was just thinking, wasn't it yesterday that, all right, May's here. I don't have to do a program now for 3 whole months. Where did my 3 months go? But I feel very fortunate about our speaker today. I've known Nadine Mitchell for a long time when I used to work in the Diabetes Learning Center. And I've listened to her many times, and she is extremely knowledgeable when it comes to prediabetes and diabetes and nutrition, and is now even currently going to school to become a nurse. I think she's crazy, but okay. Anyway, and in case I have not met you, I'm Laura Scott. I'm with Kadlec's Healthy Ages. We put these programs on once a month if you're new members. You'll be getting another card next week for our October program, so watch for your mailbox. And then we'll have our Christmas party in December too, and those invites will be out in November. So please keep your eyes open for that. So let me introduce Nadine Mitchell from Kadlec's Diabetes Learning Center.
Thank you, darling. Thank you, Laura. Well, I'm privileged to be here, and I hope that what we talk about today will be beneficial to all of you. So at the end, we'll have some questions, time for questions, so feel free to ask questions, whatever you need to ask. So let's go ahead and get started. This is just a list of the things that we're going to be talking about today. What is prediabetes? What risk factors contribute to prediabetes and diabetes? How does it progress to type 2? And what lifestyle habits prevent diabetes or delay its progression? And then we'll talk about food last, because that's my favorite topic. So, okay. So first of all, what is prediabetes? It's also called impaired glucose tolerance or impaired fasting glucose. Those used to be the terms. Now it's prediabetes. We have a joke where I work where the doctors used to tell people, oh, you just have borderline diabetes. We don't need to worry about it yet. And we used to tell people, well, we still tell people, being borderline diabetic is like being borderline pregnant. So either you're diabetic or you're not. And unfortunately, there's no borderline. Actually, borderline is pre-diabetes. And so that's the important message, is that there's a lot that can be done about it before you get to that place where you're actually being diagnosed with diabetes. So that's the good news, okay? So it's the condition before type 2 diabetes, and it just means that your blood sugar levels are getting higher than normal, but they're not high enough to be diagnosed with type 2 yet. Can you hear me better? Sorry. Is that better? Okay, I'll try and hold that right there. Okay, so this is kind of a nice little table that indicates what blood sugars should be. So the normal blood sugar, if you don't have prediabetes or diabetes, it should be, on a fasting basis, should be between 65 and 99. If you start hitting 100 or above, that's when we start knowing that there's beginning to be a problem. If the doctor, or if you were just to test your blood sugar at any given time after eating or just a random, it should always be less than 140 if you still have normal blood sugar, okay? So prediabetes, when you start hitting fasting levels between 100 and 125, or a random or after eating between 141 and 199, that's the indication that you're in that prediabetes range, okay? Now, and then diabetes is diagnosed once you hit 126 or higher on a fasting level, or higher than 200 random, okay? So that will help you kind of take a look at your lab reports. It might be even a good idea to go back to past lab reports and just see, is your fasting blood sugar creeping up? And some people who have been diagnosed with prediabetes actually have blood sugar monitors, and they can test your, you can test your blood sugar using one of those as well. So, okay. All right, there's another blood test that the doctor can run, and this is a newer one that we're using actually to diagnose prediabetes. We didn't used to use it for that purpose, just for diabetes, but now they have this new criteria. If you test with this hemoglobin A1C, it's also called HbA1c or A1C, kind of depends on what your doctor calls it. If you're hitting between 5.7 and 6.4, that means you have prediabetes. And diabetes is diagnosed if your A1C is 6.5% or higher. Okay, so that's another indication. And legally, when we have somebody referred to our Center for Diabetes Education, we have to have 2 blood sugars that are above normal to actually qualify as diabetes or prediabetes. Okay, and this test is kind of, it's different than just a blood sugar test. If you just take your blood sugar using a blood sugar monitor, that just gives us a snapshot of what your blood sugar is right at that moment. The A1C works a little bit differently. It basically gives us a 3-month average. It's a pretty accurate test, and that's why we like to see what the A1C is. Okay. All right, so just as a review, I know you guys have all seen this before, but we're just going to review the different types of diabetes. Type 1 typically occurs in younger people. It's a little bit different way that it hits you, type 1, than type 2, and that's the difference. Diabetes is diabetes. When you have diabetes, it's the same problem. It's just, it's different if you, depending on your age and whether or not you need insulin from the get-go. So type 1 basically is that where a person's pancreas, just for whatever reason, is not producing insulin, and they have to inject it from the beginning. Type 2 diabetes basically results from, and I'm going to explain all of this, insulin resistance combined with just inability to make enough insulin. So, so type 2 generally has been thought of as an older person disease, but that's not the case anymore. We're seeing younger and younger people with type 2 diabetes. Our classes used to be made up largely of kind of retirement age, and now we're seeing a lot of working people, 40s, 50s, developing type 2 diabetes. And unfortunately, we're seeing a lot of children with type 2 diabetes, and that's the most difficult thing to see, because we know the younger you are when you have, when you're diagnosed with diabetes, the more likely it is that you will need insulin, and the more likely it will be that you'll suffer complications if it's not well controlled and those kinds of things. So that's the disturbing thing about the face of type 2 today. And then gestational diabetes, of course, just as the title suggests, happens during pregnancy. It's usually temporary, but we do see women who have repeated pregnancies with type 2, with gestational diabetes do develop type 2 much quicker than those who just have 1 or 2 pregnancies. Okay, so let's talk about what causes prediabetes and type 2 diabetes. Of course, age, as we get older, our bodies just don't function like they should. It's a bummer, but it's the truth. And heredity is one of the biggest risk factors for diabetes. If you have diabetes in your family, the likelihood of you getting diabetes is higher than somebody who has no diabetes. So genetics is a really big driver for diabetes. In fact, if you have a strong family history of diabetes, you could do everything perfectly right. You could eat perfectly healthy foods, exercise every day, manage your weight, and you still probably will get diabetes. And so it's really important to understand that genetics is just a big driver of that. And not everybody who has diabetes has it. You know, we like to tell people it's not your fault that you have diabetes. It's, you know, we're mortal. Things happen. So, so we try to take the guilt out of diabetes. It's not it shouldn't be, I caused this, okay? We know that as we gain weight, we tend to be more insulin resistant. Again, I'll explain all of that. Physical inactivity, high blood pressure. Certain ethnic groups have a higher risk of type 2 diabetes. The Hispanic population, African American population, some of the Asian populations have higher risk, okay? And then also I mentioned gestational diabetes. They have a higher risk of developing type 2 diabetes. And there are some other things that are thought to be contributors to diabetes, okay? And something that's really important is to understand that there are multiple organ systems involved. It's not just about one thing that's not working correctly. One of the things is that our pancreas isn't making enough insulin. We call that insulin deficiency. Our cells aren't making the insulin correctly. That's insulin resistance. And the liver, guess what? Your liver makes sugar. And in diabetes, your liver makes too much. And so all of these things, plus there's been a more recent finding that there is a deficiency of some digestive hormones, which some of the newer medications provide those. So, so it might be necessary for somebody who has diabetes to take multiple medications that target different places in the body. And that doesn't mean you're doing things wrong or that your diabetes is getting worse, you know, or anything like that. It just means that, well, we need to target the liver and we need to target the pancreas and we need to target, you know, the cell. So that's just how it is. So we'll talk about all of those things. So, yes. The question was vitamin D, about vitamin D levels. There is some research to suggest that vitamin D deficiency is contributing to the body's inability to, you know, function the way that it needs to in order to have blood sugar control be normal. That hasn't been, you know, specifically finalized, or I can't think of the word for that, but yeah, there's some studies are suggesting that vitamin D does have a role in that. But you know what? They're also finding that vitamin D deficiency has a role in depression and other autoimmune diseases, skin disorders, a whole bunch of things. So it's one of those things that we're finding a lot of people are deficient in, and since we're talking about it, it might be a good idea if you haven't had your doctor check your vitamin D level to have that done. He or she has to order that separately from your normal lab work. And so it wouldn't be a bad idea to have that checked. And if you're low, it's easy to take care of. You just take a vitamin D with, it's the D3 is the active form of vitamin D, and the doctor can give you guidelines on how much to take. Okay, good question. Okay, so multiple organ systems are involved. Let's talk about insulin resistance first. Insulin resistance basically means your cells just aren't opening up like they should. And this picture actually shows a normal cell. And if you look at these little things right here, I call these parking spots. These are your insulin receptor sites. The yellow dots represent insulin, and the blue dots represent glucose. So you can see the insulin parks here, and that's what opens up the cell, and the glucose can get in there. So a normal cell, like as you can see on the slide, says that a normal cell has about 20,000 of those little parking spots. And the problem that starts to develop when you develop prediabetes is that you have fewer receptor sites. You go from 20,000, now you're down to 5,000 or so receptor sites. And so the insulin's there, you're making insulin, you don't have type 1, you have type 2, so you're still making insulin. It's just that the problem is there's no place for the insulin to park so that the cell can get open so the glucose can get in there, okay? And that's what we call insulin resistance. Okay, there's another thing I mentioned, the liver has the ability to make sugar, and that's typically a backup mechanism for your body. Excuse me. If you are in a state of in a fasting state, your blood sugar needs to not plummet. You need to not go too low. And so your body has these backup hormones. There's one called glucagon, which works opposite of insulin. Insulin gets the sugar out of the blood into the cell. Glucagon gets sugar from the cell into the blood if your blood sugar is starting to go low. So you have these really fine-tuned mechanisms that your body uses to keep things under good control. You don't want to be low and you don't want to be high. So depends on what's happening. If you're eating, then insulin's going to go into effect. If you're in a fasting state, your liver kicks out sugar and glucagon does its job. Okay? So as prediabetes develops, the liver makes too much sugar, and that also contributes to elevated blood sugar levels. Yes, she was asking what is considered fasting. It's typically, like when you go in for a lab draw, you usually fast for at least 8 hours. If it's like a lipid panel, if your doctor's checking your cholesterol and things like that, it's more like a 12-hour fast. So yeah, from evening till morning is fasting. And in fact, this happens often in the middle of the night is when the liver really kicks into gear because you're not eating, right? You're in a fasting state, your blood sugar's dropping, and so your liver thinks that it has to go to work, and in diabetes, it's doing too much. And so this is something that we see happen a lot. In fact, we have people experiment with this when they're doing their blood sugar testing. We'll have them check their blood sugar, say 2 hours after dinner or before bed, and then we have them test it first thing in the morning in a fast, before they eat breakfast. And oftentimes they're higher in the morning after having fasted all night than they were 2 hours after dinner. It's the craziest thing. But that's the liver. Yes. So his question is, he says that his lowest blood sugar is his fasting blood sugar. That's how it's supposed to be. When you're in a fasting state, it should be at the lowest point. It can be as low as 70 and still be considered normal. So a 97 first thing in the morning is still considered a normal blood sugar. And then he mentioned that after he eats breakfast, he'll test his blood sugar and he'll be, say, 120. Is that what I heard you say? 120 to 130. Okay. And those are normal blood sugars. You should be less than 140 2 hours after having eaten. So your fasting blood sugar was normal and your 2 hour after breakfast blood sugar was normal. Yeah, so blood sugar, you know what? We're going to talk about that. So let's keep going, and we'll ask some questions towards the end, if that's okay with you. So we're going to talk about how is food normally digested. We're going to talk about normal digestion here, okay? So we eat certain foods, and we're going to talk about what foods turn to sugar, but the foods that we eat turns to sugar. And you can kind of see on this diagram, there's some little gold, little drops coming out. That's supposed to represent the sugar that you're getting from the foods that you eat, okay? So we eat, sugar comes from the food. That's normal, and that's good. That's how our body functions. The particular foods that turn to sugar are called carbohydrates. And they're really important foods. Carbs, I think, have gotten a bad rap. We hear carbs are bad, you shouldn't eat carbs. Well, guess what? When you eat carbs, that's like putting gas in the tank. You gotta put gas in the tank. You can't run on empty, right? Now your body can shift to other fuel sources, and so like an Atkins approach can still be okay. Your body doesn't function quite as well when you don't eat carb. It can kind of compensate for all of these abuses that we do to it. But we need our carb. They're not bad. Okay? So as we eat, and you can see this little line is going up showing that as you eat, your blood sugar goes up. So it shows your blood sugar. And that's one of the things that tells your pancreas it's time for insulin. When your blood sugar level starts going up, your pancreas goes to work, makes insulin, and that helps shift the sugar out of the blood, and so blood sugar levels come back down. The key is it's not supposed to go out of this normal range. So when everything's working right, your blood sugar is not too high and it's not too low. Okay? And so as carb is digested, and again, this is showing the little gold drops representing sugar, and the little blue drops represent the insulin, and you can see that the sugar's getting into the cell, but that's because the insulin is there to help escort it there. You have to have insulin for that to happen. Okay, so basically, by the time a person is diagnosed with type 2 diabetes, guess what? Your insulin production is less by 50 to 60% normal. And so that's not good because you're not making the insulin. And the reason that happens is, remember how we talked about insulin resistance and how there's not enough parking spots for the insulin? Well, that means that the blood sugar levels are going to be higher than they're supposed to be, right? And so the blood sugar is high, still high, even though the body's making insulin. So guess what? The pancreas works overtime to make more insulin to try and handle the high blood sugar. Over time, guess what happens to your pancreas? Can it keep going at that, working overtime 24/7? No. After a while, it just can't do it anymore, okay? So over time, we make less insulin. And that's one of the other issues with diabetes. You make less insulin than you used to make, okay? So there's all that sugar, and there's some insulin there. You can see the little blue drops there, but there's just not enough to handle all of the sugar that's present. And so that also contributes to, oh, wrong thing. That also contributes to high blood sugar. And just as a note of interest, if anybody wanted to know, your pancreas is located underneath the stomach right here, and this is your liver. So all your gastrointestinal organs are right in there. Okay. All right, so let's talk about what can we do about it now that we know what it is and how it happens and what causes it. Let's talk about how to delay or prevent type 2 diabetes. The first thing, and guess what? It's not rocket science. We all can do this. This is easy stuff. So eat a healthy diet, which means eat less fat in the diet, eat fewer calories, increase our physical activity, and weight loss. Those are, guess what? In the research, those are the 3 things that helped the most of anything else in delaying or preventing the onset of type 2 diabetes. So that's good news, right? It doesn't take a lot of money. It doesn't take a lot of brains. It just takes some initiative and some effort to treat our bodies like they need to be treated. Okay? So let's talk about exercise for a minute. Exercise is really important. The research shows that most of us, all of us, need at least 30 minutes a day, most days of the week. And that's just for basic health benefits. That's not going to probably help you lose weight, but you get a lot of health benefits from being physically active. And so if you wanted to lose weight, you'd have to ramp it up to about 60 minutes a day. Again, this is based on research in this field. And if a person is already obese, they might have to even go 60 to 90 minutes to really have some weight loss. Now, I don't want that to make you feel like, yikes, I just can't do that. That's okay. You don't have to do that. Just do something. Just move. You don't have to train for a marathon or do something really difficult. All it takes is just finding ways to move every day. And there's some examples, some pictures of things: walking your dog, washing your car. Look at that. A guy is vacuuming on there. I thought that was pretty cool. So yeah, just move. Just find ways to move. I have a friend who, she's a very active woman. She's probably in her late 70s now, and she still is just as, wow, she's my hero. And she has horses, and she grows a giant garden every year, and just passes all this food out to all the neighborhood. And her doctor told her she needed to start exercising. And she said, well, but I have horses that I groom and that I ride, and I have he said, no, that doesn't matter. That doesn't count, is what he said. You need to get out and walk. And I asked her, so when you're grooming your horses, how long does that take you? She said, more than an hour, because she has several horses. I said, guess what? You're exercising. So, it doesn't have to be a real program. You don't have to get all decked up and go to the gym. I would never exercise if I had to go to the gym. So just pick something you enjoy. That's one of the keys, is finding something you enjoy, or just work your, typical daily routine. Make sure that you're, maybe put on the radio when you're vacuuming, or, well, I guess you couldn't hear the radio if you were vacuuming, but, make it fun and just move. Yeah, construction workers or UPS drivers, yeah, I think they're getting their exercise. So weight loss is important, but again, it doesn't take a lot, and this is the great news. The research shows that only 10 to 15 pounds of weight loss can help improve insulin resistance. And another way that you can look at that is losing 5 to 7% of your body weight. And I thought that was really interesting because what they did was they looked at people who really needed to lose a lot of weight, for example, 100 pounds. And they found that after just the 10 to 15 pounds of weight loss, that's when they saw improvement in their blood sugars. After 100-pound weight loss, there was no difference from that 10 to 15 pounds. Isn't that interesting? And you know, we had 2 clients who came through our program. Both of them, there were 2 men. They both lost 100 pounds. One of them went off his insulin and one started insulin. And so that's because one was in a place where his body could still handle it. He just had to kind of help it by losing some weight and eating better and moving more. Guess what? The other gentleman was just in that place where insulin, he just wasn't making enough. He needed insulin. Even though he lost weight, it wasn't enough to really improve his blood sugar profile. And so keep that in mind. It's not about, somebody, we hear all the time, for example, somebody who is on an insulin pump or who is on insulin, I'll hear somebody say, he eats that piece of cake and he just takes more insulin. Yeah, okay. That's what happens when we eat a piece of cake. Those of us who don't have diabetes, guess what? Our bodies make the insulin. He's just taking the insulin for the piece of cake, so what's wrong with that? Nothing. Because if his pancreas was working right and he ate that piece of cake, it would take care of it. And so it's really, really important as you have family members or friends who have diabetes, be very careful not to cast judgment, not to, say, oh, you're eating badly or you're not taking care of yourself, and maybe they're not, but they're not going to probably listen if you're being critical. So be loving and kind and try to offer help instead of criticism. Okay, so I put this slide in here just because there are oral medications and some injectable medications that are available. But metformin has been on the market for many, many years. It's a very good medication. It's very effective. It's also very inexpensive, which is even better. And in the diabetes prevention study, people who were taking metformin reduced their risk of developing type 2 by 31%. That was pretty significant. And so that's something you may want to talk to your doctor about. Some doctors won't consider it, but if you want to see what your options are, there's nothing wrong with asking what options are available to help slow down that whole progression of diabetes. Okay. All right, so let's talk about food. So these are basic tips for healthy eating, and we recommend that people eat 3 meals a day. Okay, so I want to see a show of hands. How many of you eat breakfast? Very good. I was going to do it the other way, and then I thought, I'd be like, making you feel badly. So the main premise to that is to encourage you to try and eat something in the morning. It doesn't have to be a big breakfast. But it's been a long time since you've eaten dinner. All of those hours have passed, and it's a good idea to put some fuel in. You got to put some gas in the tank. And so there are a lot of reasons why people don't eat breakfast, but it would be a good idea to just have a little something, okay? You might even need snacks in between. And the general guideline for this is we recommend that if you're going longer than 4 hours between meals, you probably need a snack. So if you're an early riser and you eat breakfast at 6 and lunch is at 12, guess what? That's more than 4 hours. It's a good idea to have a snack about 9 o'clock. And you may even have discovered that if you go for a long period of time, you start feeling that foggy head feeling, you can't think, you get kind of crabby maybe, shaky and weak. Some of those are symptoms of low blood sugar. And so one experiment you can try to see if it is low blood sugar is just eat something. Eat a piece of fruit or a yogurt or something like that. And if your symptoms improve, then that was probably low blood sugar. Keep in mind that those symptoms can be caused by other things like low blood pressure and things like that. So just know that. But it's a good idea to have a snack in between. Again, about 3 o'clock in the afternoon, many people benefit from having a snack. And I didn't mention this when we were talking about the liver making sugar, but guess what? We tell people who have higher fasting blood sugars in the morning, we tell them to eat a bedtime snack. That sounds kind of counterintuitive, doesn't it? You're telling me to eat, so my blood sugar will be lower? Yes, and that's because that helps turn the liver off so that you don't have a high blood sugar in the morning. So, and that doesn't work for everybody, but it works for most people that we have them try that. And so that's one thing too that we usually recommend is to eat a bedtime snack. And by a bedtime snack, I don't mean, the banana split with all of the syrupy and, all of the yummy whatever stuff that goes on it. A normal snack, some cheese and crackers or a small bowl of cereal or half a sandwich, something like that would be just fine for a bedtime snack. Okay. Avoid skipping meals. There is some research that shows that people who have diabetes who skip meals have higher blood sugars. Again, that's because the body is trying to, keep things in balance, and if you don't help it out by having consistent meals, then things kind of go out of whack. And these, you've heard this before. You just need to eat a variety of whole grains, fresh vegetables and fruit, lean meats, fish, beans, and low-fat milk products. And then limit fats and things like that. We're not going to talk a whole lot about fats, but that's part of the profile as well. So when you look at foods, they're usually a combination of these three things: carbohydrates, protein, and fat. Okay? And guess what? We call these essential nutrients. Do you know what that means? It means your body has to have them provided. It cannot do what it has to do without carb. It's essential. It cannot build new tissue and blood and hair without protein. It has to have it provided in the diet. And fat is also an essential nutrient. It really is. The thing is that our diet, if you look at the American diet, it's too high in fat, and that's why we have the problems that we have. But fat is an essential nutrient. Now, so we already talked about carb and how that is the main nutrient that raises blood sugar. And so if you have problems with this whole function of blood sugar control and you eat a giant amount of carbohydrate, guess what's going to happen? You're going to have high blood sugar. And so that's the issue with this, is knowing how much you need. And that's what this slide is for. Okay, so this basically shows, and I want to emphasize that this is per meal, not per day, okay? So for example, let's say I wanted to follow these guidelines, and let's say I wanted to lose weight. I could do 3 carbs per meal, and that would be an appropriate amount of carbohydrate to provide what my body needs and to still have some weight loss happen. That's 9 carbs a day. That doesn't count my snacks, okay? I need to have at least 1, maybe 2 if I'm hungry, per snack. So if I'm eating 3 snacks a day, that's another at least 3 carbs, right? So that's up to 12 carbs I'm eating a day. And people who are used to doing kind of a low-carb approach, their eyes kind of go really big and they say, really? You want me to eat that much carb? Uh-huh. About half of your calories should come from carbohydrate. That's your body's fuel, okay? So you men in here might be around 4 carbs per meal. If you're very active or have a higher metabolism, you might need more than that. But most of us in this room, probably 3 to 4 carbs per meal is an appropriate amount. Okay? All right, and that's per meal, not per day. You need to know that 1 serving of carb is a 15-gram portion. So if I were eating 3 carbohydrate servings, that would be 45 grams. And we don't use the metric system very much here in this country, but food labels have carbs listed in grams, so that's why you need to know that. And we're going to look at a food label here in a minute, but thank you for asking that question. So yeah, I could look at it in terms of number of servings or number of grams of carbohydrate. So I could say, I'm going to eat 3 carbs per meal, or I could say, I'm going to eat 45 grams of carb per meal. Guess what? It's the same thing. It's just a different unit of measurement. Okay? Okay, so let's talk about what foods contain carbs. Anything starchy has carb. So that includes all of your grains, beans, starchy vegetables. Now, as it says on the slide, non-starchy vegetables contain a small amount of carbohydrate, but we don't count them as carbohydrate foods. If you looked at classification of foods with carbs, you would find non-starchy vegetables in the scientific classification of carbohydrates, but they have very little compared to other carbs. So I'm going to emphasize this later too, but they're pretty much a free food. Fruit has carbohydrate, milk and yogurt have carbohydrate, and of course anything with sugar, any sweets have carbs. So those are all of our carb foods. So in that, say, I can call it my budget, my 3 carbs per meal, I could choose any of those carbs, and that could fit in my carb budget, okay? And so remember that carbs aren't bad. It is true that some carb foods are more nutritious than others, okay? So I could choose an apple, and that's going to be a carb. It's also going to have some good nutrition and some fiber. Or I could choose a piece of chocolate cake, and that's going to be super delicious, and it's going to provide carb, but not as many nutrients as, say, the apple. You see what I mean? So if you were going to assign good or bad to something, I guess that's where I would say that the cake would be the bad carb, if you want to say that, and the apple would be the good carb. But we try and teach people to get away from labeling things as good or bad and just looking at all carbs and how those fit. Yes. She was saying that she classifies milk and yogurt as protein, and that is true that they are also a protein food, but they have as much carb as a piece of fruit. And so, yeah, and so beans have protein, but they're also a carb. And so when we teach people in our classes how to follow their meal plan, we kind of move foods into kind of a little bit different categories than perhaps what we learn in school, for example, or on the food guide pyramid or whatever food thing that you're looking on. We have to classify all of the carbs as carb because those are the things that are going to affect the blood sugar. So that's just a bonus that they have protein, but they're still a carb. So remember, we're thinking of this in terms of diabetes, so we have to, it's a little bit different way of thinking of it. Okay, so servings matter, right? So we have to be careful with portions. And that's why, for example, just to give you an example, I didn't bring any things to look at up here, but if you were to pour a glass of orange juice, do you know how big your cups are, or your glasses in your house? Do you know how many ounces you're going to be pouring a glass of juice? Did you know that a 4-ounce glass of juice is 1 carb? So my son, who is 22 going on 12, but we won't go there, he likes to pour juice, which we don't have juice very much in my house anyway, but we happened to have some juice one time. And he got the biggest cup in the cupboard, and I swear that thing was a 32-ouncer. So that was like 8 carb servings right there. And good thing he doesn't have diabetes. But, I'm just saying, you have to kind of be cognizant of that. If you have diabetes, and you have to be aware of portions. So that's one of the things. Now, this is an approach that is kind of a newer approach, the plate method. You can see that half of that plate is non-starchy vegetables. That's a good way to start. And then you've got your starch in a quarter and a protein in the quarter of the plate, and then you've got your fruit and milk apart, if you drink milk or have a yogurt with your meal. That's just one way to do it. But you still have to be aware that your carbs are coming from these 3, your fruit, starch, and milk. Okay? Okay, so carb counting. It's kind of like what I was referring to earlier. If you have a certain budget or a goal to have 3 carbs or 4 carbs in a meal, that's your budget, right? And if you know like if you're looking at the food you want to prepare for your meal, if you can identify which foods are carbs, then that's half the battle. If you know how much you should have and what foods are going to have the carb, then the rest, we're going to talk about portions here in a minute, but that's part of the issue is identifying. You have to be able to look at your plate or your food and be able to pick those out. And then, of course, 15 grams is 1 serving, as it says on that slide. Okay, so food labels. One thing I think that people don't realize is you got to look at the portion size of the thing offered of the food, because the amount of carb depends on that serving. okay? So remember that 15 grams is 1, so whatever this product is, if I pour myself, I think it's a liquid, it must be a liquid because it's in fluid ounces. So if I pour myself an 8-ounce glass of this product, that's 1 carbohydrate for me, okay? If, like we had this was pretty hysterical. We had this guy in class, and and it was summer, and he had this Gatorade. It was one of the big Gatorade bottles. And he said, "You guys, look, this only has 15 grams of carb in it." And his classmate looked over on the label and said, "Dude, that has 4 servings in it." And he was so bummed. Oh, no! So he thought the whole thing had 15 grams of carb. So you do have to pay attention to that portion size up there. Okay? Now, one thing, too, that people don't realize, when you're looking at food labels, the fiber and the sugar, do you see how they're indented? Those numbers are already included in that total. So we have people who say, well, I just look at the sugar. Well, if all you looked at was the sugar, you'd still be missing maybe starch or dairy product that it might have in it, okay? So if you look at the total carb, that's really the big picture right there. You can look at the sugar if you want to. That's kind of deceiving just because, well, for example, if it's a fruit product or a milk product, the food label, the way it's listed right here, doesn't tell you how much of that is natural sugar that's just found in fruit or in milk. And so that can be a little bit deceiving. So for example, this is your homework when you go to the store next time. Go look at 2 yogurt containers. Find one that is a sugar-free one and one that is not a sugar-free one, and compare the labels. You'll see that the one that isn't sugar-free has a lot more sugar in it. But if you look at the sugar-free one, you'll see that it still has a large amount of sugar compared to the carb in it. That's because yogurt is a carb. Okay? So if it's sugar-free and they put artificial sweetener in it, they're not adding sugar, but it still has sugar. So don't kind of get caught into that little trap of thinking, yikes, they're putting a lot of sugar in here. No, it has sugar. It has natural sugar. So the next few slides are just some lists of 15-gram carb portions of different foods. So you can see a slice of bread typically is a carb, but keep in mind that's a generic bread. You can get some breads that are really thick or heavy, and those might be 30 grams per slice. You might get like a diet bread that's a smaller slice, a thinner slice, and is just a bunch of white flour, and that you might be able to eat 2 pieces of bread for 1 carb. So be sure to look at your bread and just see, where that falls into there. A lot of people are surprised to find out that rice and pasta, that 1/3 of a cup cooked is a 15-gram portion of carbohydrate. Yeah, somebody's so yeah, it's rice and pasta are very problematic for people with diabetes. They find that it's really hard for them to eat rice and pasta without having high blood sugar afterwards. Now, since I just thought of this, there is a pasta product that we do recommend that people try. It's called Dreamfields, like dream, like you're dreaming, Dreamfields pasta. It's made. They put a plant fiber called inulin in there, and their claim is that it makes less of the carb digestible. And we do know that fiber does slow down the absorption of sugar into the blood. And so if you have a meal that has a good amount of fiber, you tend to your blood sugar spikes less. So we're kind of running out of time. So you got this in your handout. I'm just going to kind of scroll through here. Fruit. A small piece of fruit or half a cup of canned fruit, half cup of juice. For dairy, usually a cup of milk. Yogurts vary a lot, so you just have to use your food label to determine what is an appropriate amount of carbohydrate in those. Sweets, guess what? Sweets are on the list. So, and that's a good thing because, if I were to tell all of my clients, okay, first I would ask them, what's your favorite sweet? You can never eat that ever again. Human nature is to want to go eat it right now because I was just told I can't. And so it's a better approach to be able to help people eat their favorite thing. They're not going to, we don't stop eating our favorite things, but we can learn how to include them in a healthy way. Okay? Non-starchy vegetables, eat all you want. Just be careful what you put on them, because that doesn't necessarily add carb, but fat, and that can sabotage weight loss if you're trying to do that. Foods that we consider to be free foods are things like coffee and tea, spices, condiments. If it's a sugar-free food and it has 5 grams or less of carb per serving, then that's also considered a free food. Artificial sweeteners, I don't want to spend a whole lot of time. There's a lot of controversy. A lot of people believe they're poison and all of that. I don't believe they're poison, but I think anything in moderation can be bad for us. That's not in moderation can be bad for us. So I think for that person who's drinking, a 6-pack of diet sodas every single day of their life, that's probably not a good idea, or, big gulp or whatever. But I think that they have their place. And there's a newer one on the market called stevia. That's from the stevia plant. It's a natural plant. So if you are worried about eating chemicals, which guess what? Nutrition 101, the first sentence out of my professor's mouth was, food is the chemicals we eat. So that's chemicals. Okay, so meat, if you look at the palm of your hand, you need about 2 of those a day. That's one reference. This handout, or this slide shows about the size of a deck of cards. But if we had a tiny little lady, she'd have a tiny little hand, right? If we had a big construction worker, he'd have a big meaty hand. So I like to use that reference more than the deck of cards, because a bigger person needs more, okay? Other protein foods, you don't have to be a carnivore to include protein. Of course, there's, soy products and peanut butter and eggs and things like that. As far as fat's concerned, this is kind of a general recommendation, about 3 to 6 servings a day, and a serving is about a teaspoon. So that gives you perspective with regard to fat. If you feel like you want to hear more about fat in the future, just let Laura know, because we could do a talk on heart disease and fats, different fats and fat products. Don't have time to talk about that today. So anyway, the bottom line to avoid or delay diabetes is really, again, it's not rocket science. It's healthy lifestyle. It's having regular physical activity, controlling weight, and eating healthfully, okay? So, and that's something all of us can do, and you don't have to have a degree. You can still do that, okay? All right, so I hope that answered most of the questions, but we have a little bit of time. If anybody has questions, I'd be happy to answer. Yes? He was saying that it depends on what he's reading in terms of what the normal blood sugar levels or diabetic blood sugar levels are. And it's true, it depends on what you read. Different publications are going to have different levels. The levels that I used in your handout, that was from our actually lab. That's from our lab at Kadlec. And so you might go to a lab that has a little bit different, but it shouldn't be much different from those numbers. Yes? No, beer is not a free food. Beer is a carbohydrate, so fits into your carb. So a 6-pack of beer, not a good idea. But you could have a beer with, and have that as your snack, or you could have that with dinner or something like that if you weren't going overboard on carb during dinner. But yeah, in terms of other alcoholic beverages, since we're talking about alcohol, wine and distilled liquor do not raise blood sugar. Not to tell you to go out and drink those things, but those aren't going to have the impact that beer would. So, good question. Yeah, you can have a glass of wine with dinner, and that's fine. Yes. Yeah, she's talking about the slide that talked about multiple organ systems being involved in diabetes, and the one statement that we lack digestive hormones. And she's asking, how can we get those hormones? There are some of the newer diabetes medications that are on the market now provide those or help those stick around longer. Those usually are not prescribed for pre-diabetes, but we see people with diabetes who are on those, and they show very good results. I'm seeing really good things with medications like Victoza. So it's exciting to see that. It's more than just, insulin. So, yes. That's a very good question. She was asking, is there a correlation between having low blood sugar when you're younger and then having diabetes later? And yes, I would have to say yes. It's low blood sugar is another it's another way that your body is unable to control things. And so over time, yes, that can happen. And I've seen people with low blood sugar develop prediabetes and diabetes. No, your pancreas can make as much insulin as you need. It's just that during that stage of insulin resistance, when your body's trying to overcome that and it's making tons of insulin, it just kind of wears it out. So I think overall, our human bodies are supposed to make enough insulin. It reminds me of the joke that, your heart only has a certain number of beats and you wouldn't want to waste them exercising or something like that. No, it's not like that. Your pancreas can make enough insulin. It's just that during that stage, it just has to work too hard and then it just burns out. So so his question is about fructose. Fructose is fruit sugar, right? It's found in fruit. And it is used for like a sweetener in some food products. The reason it is interesting. It has to do with your biochemistry. Your body actually doesn't metabolize fructose like it does sucrose or lactose or other sugars. It has to go through your liver. And so it tends to not make you produce insulin to metabolize it. And so the nice thing about fructose is you don't tend to get the spike from that. So, but you're correct, you still will have an effect, a blood sugar effect, but not like other sugars. And so oftentimes they'll use that. See, I saw another hand over here, did I not? Yes. He's asking about artificial sweeteners. There's, like I said, a lot of controversy about artificial sweeteners. I think that some people can have sensitivities to different ones, and I think you just have to listen to your body. I also am a proponent of, eat things as close to its natural state as possible. I don't put sweeteners in everything that I eat, but I do have it sometimes. And so but I don't have any sensitivities to them either that I've noticed. And it helps me sometimes, if I eat sugar-free pudding, I'll get less calories than if I eat regular pudding, right? And for me, I have to watch my diet. I gain weight pretty easily because I like to eat. So weight's an issue with me. So if it means that I can get fewer calories from eating a sugar-free pudding than regular pudding, I'm going to do that. But I don't personally and professionally think there's anything wrong with artificial sweeteners, but I think that some people can have sensitivities, and you have to just do what you think is right for you. Splenda is not digestible. It goes right through your digestive tract, so it has no effect on blood sugar. Let's see. So let me see if I understood your question. So you're asking, are there foods that can provide the digestive hormones that we lack? Not that I know of. That research is fairly new. It's come out in the last about 5 or 6 years. And so we've got some really great new medications that help with that. Not that I'm aware of, are there any foods that contribute to that? Just a second, nuts are really very good for us. The problem is they're also very high in calories. And so unless you are skinny and need to gain weight, you probably shouldn't be eating nuts all day long. When we have somebody who's trying to gain weight or who, is struggling with weight loss, we'll tell them, put peanut butter on stuff, eat nuts, slam cheese on that sandwich, So, yeah, they're really good for us. It's just that it doesn't take very much to equal a lot of calories. Okay. Yes, medications can cause a lot of side effects, but you know what? Do you want to hack off a foot or lose your vision? I mean, if it comes down to it, am I going to take Actos or am I going to have a dialysis? I will take Actos. I will take insulin. I will do whatever it takes to control my blood sugars, because the complications of diabetes, wow, horrible. And I don't want to scare you, but they're horrible. They're scary. So yeah, it's true. And some of the diabetic medications have been, associated with things like pancreatic cancer. Anyway. There is not, you know what, I read the studies on the Avandia and the Actose, and the numbers were so tiny. And you have to understand too, when you have diabetes, you have a higher risk of developing those kinds of cancers and those kinds of inflammation. So I am not convinced that those medications are bad. I would, you know, so maybe if I were concerned about that, maybe I would just tell the doctor, just put me on insulin, because your body makes that. It's a hormone that's already used by your body. You know what? That's what I would do. So, but it's all about controlling the diabetes. Okay, I guess we have one more. Okay. Uh-huh. Yes, I agree with that, because if it's published by the American Diabetes Association, it has to be evidence-based. So I would trust that over Better Homes and Gardens. Although I think Better Homes and Gardens does have a publication that is published. You know what? I saw something that had the Better Homes and Gardens tag on it, and yet it looked good to me. Yeah, they do have some good recipes. So, okay. All right. Thank you.